This is a relay project.
Real Talk starts right now. Here's Ryan Jesperson.
Real Talkers, Alberta's government is moving sharply to restrict access to medical assistance in dying, limiting it to people whose deaths are considered reasonably foreseeable, likely within the next year. It's obviously a subject that prompts much debate and impacts many people in about as personal of a way as is possible. The new legislation will also ban access for minors, people with mental illness as a sole condition, and anyone not near end of life. Supporters say that this is about protecting vulnerable people, especially those with disabilities, from being pushed toward death in a system that too often fails to provide adequate care and supports. Meantime, critics argue the province is overstepping, adding barriers, and undermining patient autonomy in deeply personal decisions. One of the groups that has been advocating on this file is Inclusion Alberta, and in 30 seconds we'll be joined by CEO Trish Bowman to talk about why and whether or not these limits go too far. We will also look to our live chat powered by Park Power for Real Talkers' take on this. We have a couple of very impactful emails that have already been submitted to talk@ryanjesperson.com. And if you're watching this or listening to the podcast after our live stream, as always, we invite you to leave your comment on the episode and let us know how this issue impacts you or your family and what you think about the changes to the legislation. This episode is happening with the presenting sponsorship of our friends at Hansen Distillery, and in particular, their new Mini Yeggs Cream Liqueur. This is a new, incredible candied milk chocolate experience that has been sweeping the province. That's right, we've been hearing from Real Talkers in all corners of Alberta, some of you beyond, that have gone to hansendistillery.com to order your bottle and have it shipped straight to your home. This is a moment essentially of pure nostalgia. This velvety cream liqueur from the family-run distillery, Edmonton's first, by the way, a sophisticated homage to childhood treats that blends creamy milk chocolate with a delicate, crisp, vanilla-dusted candy shell, and of course, Hansen's signature silky smooth cream. You can find Mini Yeggs at the distillery, 174th Street, 111th Avenue, just north of Mercedes-Benz Edmonton West. If you happen to be in the Metro Edmonton region, you can always find it online at hansendistillery.com. And of course, you can always ask for Mini Yeggs wherever you buy fine Alberta spirits. Hansen Distillery is made right here. As we welcome the CEO of Inclusion Alberta, Trish Bowman, back to the program right here live in our Real Talk studio in the historic Mercer Warehouse in downtown Edmonton. Thank you for making time for us. I know that this is obviously, do I say a sensitive file? It's a file that has a great meaning, obviously, in many people's lives. We'll hear from some Real Talkies here by way of email. And I think you and I wanted to communicate something to our audience before we start the discussion today. Why don't you take us there?
Well, I think that, as you said, we know this is a deeply sensitive and a deeply personal topic, and that, you know, we're aware and want to be thoughtful about, you know, when we're talking about assisted death or assisted suicide, that's something that, you know, we want people to take care of themselves in this conversation and make sure that they have the support around them if, you know, these are topics that are personal for them.
Mm-hmm. I appreciate you saying that. This new legislation, and I know that you and your group have been advocating, among others, and involved in the process, so to speak, and in the public messaging and the dialogue over the past couple of days. This new legislation, people may Google it, the Safeguards for Last Resort Termination of Life Act, if passed, and it will be passed, of course, would prevent doctors and nurse practitioners from administering MAiD to patients whose sole underlying condition is mental illness. It would also require a direct family member of the patient to be present for administration of MAiD in almost all cases. The Premier, Danielle Smith, saying just a number of hours ago that she thinks that the federal guardrails around medical assistance in dying are weakening as the government considers broadening the eligibility. Why don't we try to understand your position and Inclusion Alberta's position leading up to this new legislation and how and why this has been on your radar?
Okay. So I think that what many people don't understand is there are in fact two paths to medical assistance in dying in Canada. The first is, of course, what they call Track 1, which was legalized in Canada in 2016, which is a medically assisted death for people whose death is reasonably foreseeable. That is equally available to all Canadians currently. And then that was expanded in 2021 to include individuals whose sole underlying condition is disability. This is the only charter-protected group in Canada for whom their personal characteristic, their sole underlying characteristic is disability that makes them eligible for assisted suicide, frankly, because they are not in fact dying, but they have a disability. We believe that to be deeply, deeply discriminatory. It reinforces incredibly harmful and dangerous stereotypes about the value and worth of the lives of people with disabilities. It makes assumptions about the nature of their suffering and that it is somehow qualitatively different than the suffering of other Canadians. And we believe the moral and right response to suffering is to do everything in our power to ameliorate that, not to provide a path to assisted death. So we have been opposed, not just us. The national disability community has been overwhelmingly opposed to the expansion of MAiD to include people with disabilities as their sole underlying condition. And so we support this legislation. We think it will save lives.
I want to integrate our audience and the perspectives here as much as possible. That includes from Erica here in our live chat, says there is a place for MAiD, but the scope should be very narrow. She references a case I'm not familiar with. It says, look at the tragic case of Keanu Vafanian, I believe, 26 years of age, had diabetes, partial vision loss, says that's it, and was granted MAiD. That's horrifying. Eva's sharing with us, says my husband had a terminal diagnosis in 2023 and requested MAiD. He died 3 weeks after asking for MAiD without ever having someone from that team visit him. Says he was at the Grey Nuns Hospital. That's an entirely different issue. We can talk about that and Covenant Health with regards to Catholic administration of public health care and whether or not those services are available. I can't tell you how many times I have seen comments in YouTube comment sections and on social media and feedback to our show where people have, do I say alleged or suggested or let us know that they're under the impression that people with disabilities are being prompted to consider MAiD or being led down a path toward MAiD. They phrase it differently, but the assertion is basically that people are being counseled to consider this. You're nodding your head. Is that something that you hear of anecdotally or otherwise?
Yeah, absolutely. So we know there's been reporting across the country of people with disabilities who have gone in for medical procedures and have been told, did you know that you could in fact apply for medical assistance in dying? Know of a situation, and there are many. A woman with a disability who fell out of a cab, like when it was stopped, and injured her hip. And when she went in for treatment, was told, your recovery is going to be really long and difficult. That this is a treatment option. We think, describing assisted suicide or medical assistance in dying as a treatment option is inaccurate. And so we do know that this is suggested or proposed. And if you can imagine what it would be like to have someone say that to you about what is perceived about your worth and the value of your life, that's a pretty horrifying thing.
So we would assume there are stopgaps here, right? And maybe you can help me understand how this works. But this wouldn't be, and I don't mean to come across as candid or glib or anything lighthearted about this. But if an individual was considering MAiD, they would consult with a medical professional, right? And then that case would be referred to or approved for medical assistance in that case. There would be stopgaps, I guess is the point I'm making. How effective do we know those to be, or have you seen them to be ineffective? Do you believe that in some cases the wrong people are making the decisions or maybe just making wrong decisions?
So there are federal safeguards. They're described as safeguards around what needs to happen before one is approved. for track 2 medical assistance in dying and track 1. And, the idea is those would be sufficient to protect lives. What the data is showing is that, in fact, that is not true. And so, as you described, instances where physicians actually don't meet in person with individuals, there isn't a thorough review. It is, in fact, much easier for many people to be approved for medical assistance in dying than it is to get medical treatment. Or access to social supports. So we know that the safeguards are paper safeguards, but what happens in practice is there are ways around or shortcuts through a lot of those safeguards. And what the reporting is showing is that what a lot of people are talking about that leads them to make this decision is, in fact, things like isolation, loneliness, poverty. There's a disproportionate number of people who, as I said, live in poverty, who are applying for MAiD, disproportionate number of indigenous people. So there's all sorts of social factors that are leading to people making this choice that are unacceptable, quite frankly, and we need to do better.
Yeah, I guess I'm in a privileged position here because I've not experienced this firsthand. I've not been faced with this very difficult decision. For some people, they may say it was not a difficult decision. I've not seen a family member go through it. Emily G in our live chat right now says her mom used MAiD 2 weeks ago. Says it was a quick, peaceful, and painless process. Emily says she was horribly sick with pancreatic cancer. Emily, we're thinking of you and your family today. People are sharing very personal things. I've just received some more emails as we're speaking here. I'll get to as many as we can. Trish Bowman joining us from Inclusion Alberta in our feature interview presented by Mercedes-Benz Edmonton West. I also respectfully wonder if the government is out of its lane on this one. We've seen federal law require a person requesting MAiD to have the mental capacity to request it. In Quebec a couple of years ago, began allowing people diagnosed with incurable illness to request access to MAiD in advance while they're lucid, and Alberta's legislation would disallow that. If I hesitate to even invoke examples of diseases because I don't want to suggest that I think this type of person with this disease would consider it. But to be real, how real people talk, if I'm diagnosed with ALS as an example, and I've seen family members grapple with that and ultimately pass away from it, a horrific disease, I want the autonomy to decide, and this is me, Ryan Jesperson speaking, ahead of time if that's how I would like my time on this earth to end. And number one, I don't want the government telling me I can't. And number two, I hate to say this, but this is also how real people talk. If I can't get that medical assistance in dying, there's a lot of people that will consider other ways, other methods, other locations outside a hospital. And I know for every single family involved in a scenario like that, that's absolutely devastating. How do we find something that works for everybody with legislation like this?
Well, I think it's important to know that this is not eliminating access to medical assistance in dying. If people's death is foreseeable, every person retains the right to make that decision and to have medical assistance in dying if their death is foreseeable. What we're talking about is quite different. We're talking about people whose death is not reasonably foreseeable, who have years and years and years ahead of them. And so it is a distinctly different, I think that's where sometimes the conversation becomes elevated. People think I'm taking away your right to make this choice should you be near the end of life and want to be able to make this decision. That remains. Hasn't changed. This is distinctly different. This is for people who are not dying, who have a charter protected, frankly, characteristic for it in terms of their equality rights, that is not being honored because no other Canadian can make that decision if they feel their suffering is intolerable and they don't have a disability. So it isn't equal currently. People with disabilities have a different right. It's not an equal right. They have the equal right to medical assistance in dying if they are dying. Track 2 is different.
We got an email from Deb to talk@ryanjesperson.com. She says, I was going to email you, Ryan, after your AISH episode a few weeks back. She says, but my son's life is so complicated, it would have been too long to put into words. He's a beautiful 25-year-old young man with physical, cognitive, and learning disabilities, severe mental health issues. Deb says, I'm his legal guardian and trustee as he can't function in life on his own. The Premier says she has profound misgivings about the Fed's intent to allow MAiD for people whose sole condition is mental health issues. Deb says, I love my son. I'm deeply devoted to his care, despite the toll it's taken on me. In no way would I want him to ever end his life, and I'll do everything in my power to help him build an independent and happy existence. The thought of him requesting MAiD breaks me, but with such a terrible and insufficient mental health system in Alberta, I fear even more that he'll choose to do something to himself on his own. He spent all of last year in Alberta Hospital in a locked ward. In December, despite ongoing issues, they told me they couldn't do any more for him. They discharged him back to me. I'm sure you've heard of that. Says, I was told to not leave him at home alone, to try to find community supports for him. She says, it's simply not enough. He's on age. He will be part of a group of Albertans who have their income cut short soon under this new ADAP program. You can check out our archives, Real Talkers, for more on that. Work is impossible for him, says Deb. We've tried so hard, but his disabilities preclude him from remaining at a job. And the mental health supports for individuals in the community is tissue paper thin. So for the Premier to make an announcement about her opposition to MAiD for individuals suffering from severe mental health conditions without also simultaneously announcing increased mental health supports is tragic. Deb says, I cannot stress how absolutely difficult it is for me and for him. I could take pages of examples. She says, all I can say is I hope to heaven that I don't find him one day after taking his own life, being alone, shamed, broken, in despair, because my support for him was not enough and the government couldn't stop long enough to bolster support in the community. That's a real person. That's powerful stuff.
Mm-hmm. Absolutely. And it is absolutely true that we need better access to better supports, and absolutely true with mental health supports. Both things can be true. We can need better access to supports and also protect the lives of people to the best of our ability from state-assisted death. So the answer to one is certainly not the other. And so our point is you can have supportive policy and protective policy. It doesn't negate the harm of other policy. So the failure in other policy areas needs to be addressed. We need to continue loudly and ideally in a unified way. All Albertans, all Canadians need to be telling our government we need to do better. We need better mental health supports. I don't know many families that haven't been touched by this in some way, including my own. But the answer, the absence of those things, the answer shouldn't be death. Right. Shouldn't be state-facilitated death. So we have to actually just be unrelenting in our advocacy to improve supports for people with disabilities and people with, mental health challenges, a full range of vulnerabilities.
Crystal says, according to the Premier, for those with mental illness, mental health needs, there are a lot of treatment options available. Crystal says they are not easily nor readily available as they should be. Joe says we can't be basing this on anecdotal evidence. Tracy D says but for the grace of God, there go I. If you haven't walked a mile in someone else's shoes in this regard, it's ridiculous to suggest you know better than the person making the choice. Shyla says my child has been defying low expectations for life expectancy his entire life. We believe he does so due to our commitment to provide him a life worth living for, a life worth fighting for. That's amazing, Shyla. 80s Fanify says the problem is we don't know what everyone's personal day-to-day experience is, and says I'm okay with the availability of this option. Christy says I believe in tightening regulations but not removing qualifications. I mean, everyone comes at this from their own angle. I think I hope that most people come at it with empathy and with compassion and seeking to understand this. I'm kind of past debating or arguing whether or not someone, a person, and maybe actually this is a good conversation for us to have on whether or not someone should have the right to this or the right to consider this. I'm past the sort of moralizing, these will be my words, the moralizing of it, someone's perspective on this imposed on someone else's. I believe that people should have the right to choose here, but for the human beings that you advocate for on behalf of Inclusion Alberta, it almost feels, I don't want to say like an entirely different discussion, but there are so many added layers to this. Do you believe that the public debate or public conversation is adequately informed or enlightened when it comes to some of the key points that you need to make?
No, quite honestly, I don't. I think that in our conversations with people, the majority of people really do not understand the difference between track. Many people, when we talk about Track 2 MAiD, didn't even know it existed. So they think we are talking about people who are near the end of life and who want the option to make this decision. That's not what we're talking about. I think that, we're talking about really deeply held unconscious bias and stereotypes and ableism and presumptions about the value and worth of a life with a disability. And we know, and as I said, the disability community in Canada has spoken loudly about the fact that they have contributions to make, they bring value, and they don't want assumptions made about the value of their life based on their disability. If it were any other group of charter protected people, we would see the fact that their despair is great, and that this is a choice they want to make as a crisis that deserved our immediate attention. This is a crisis that deserves our immediate attention. It's not, the answer is not then to throw up our hands and say, all right, then, this is a choice that, and we would argue a choice is only a choice if you have access to the support that you acquire.
This Bill 18 would also put new requirements and limits on healthcare providers who administer MAiD, which is kind of an interesting angle on it. Doctors and nurse practitioners would be barred from referring a patient out of province to be assessed for MAiD eligibility. They'd be prohibited from suggesting MAiD to any patients as an option. The patient would have to request the information on MAiD first. And it would prevent health facilities like clinics or continuing care homes from publicly displaying any information about MAiD to, quote, reduce the risk of undue influence or coercion, that according to a briefing from the government. Is there a risk that the government goes too far in interfering in the clinical relationship, do you think?
I'm not sure I can really comment on that. I think that part of, the intent, certainly one is conscience rights, right, to preserve that for, medical facilities that want that option. And we do, as you mentioned earlier, we do know that it can be an unconscious almost suggestion that this is something people should consider. And so, I think that those nuances perhaps are to be determined, but
I'll recognize that there's a lot of angles on this, and you're here specifically to talk about the advocacy that Inclusion Alberta is doing. As we broaden the conversation, I think it's obviously a fair question. We'll put that to our audience after the fact. People can check out more about what you and your team do, advocacy and otherwise, supports as well, of course, at inclusionalberta.org. Before we thank you for your time, is there anything that you want to leave this audience with, kind of walking words? A lot of people listen to this podcast walking their dogs, maybe out in the river valley doing whatever they do, maybe on a mountaintop, and they'll be thinking about big stuff and walking and considering things, maybe open to changing their mind or considering something new. What's something you would give us to walk with?
It's early to ask me that question. I guess I would say that among the people in the disability community who have been advocating against this and trying to protect the lives of people with disabilities for years now, this is considered almost the existential threat of our time. This is about the value and worth of the lives of people of disabilities and whether or not we believe that that's worth fighting for. And so if anything, this should be a call to action to everyone to say to our governments across the country, we need to do better. We need to provide ready access to the support people deserve to lead lives of dignity. And that needs to be, as I said, unrelenting in our advocacy. And we are all can be touched by this issue, as you said. We can all be touched by disability. And as some people will say, we're all temporarily abled. So these are things that really go to the core of who we are and what we believe about the worth and value of people. And so that would be what I would ask people to think about.
I've got a ton of respect for your advocacy, Trish. Thanks for doing this.
Thank you.
You got it. That's Trish Bowman joining us in our feature interview presented by Mercedes-Benz Edmonton West. She's the CEO of Inclusion Alberta. You can check out inclusionalberta.org if you want to learn more about what the organization is doing. Real Talkers, we're going to get to your emails, your comments in the live chat in just a moment, and obviously some really personal stuff. I want you to know that means a lot to us when you share about, like Trish just said, this is like an existential issue for a lot of people and for obvious reasons. And we don't take it lightly. And we're grateful to have an audience that doesn't take stuff like this lightly either, that can see the nuance here, that in many cases draws lines, maybe black and white for you. And you're telling us why. We'll get to more of your comments there in just a moment. Before we go any further, I want to remind you that if you check out my social media, pretty much any account that I'm on, whether that's X, Facebook, LinkedIn, Blue Sky, you're going to find a link to the Alzheimer's Pro-Am Hockey Tournament. I'm playing in this next month. Very proud to be a member of Team Cali Crush. That's the team captained by the CEO of California Closets. They've done incredible work, California Closets has, in supporting fundraising to fight against Alzheimer's and other dementias. If you click on the link, it'll take you straight to the donation page for the Alzheimer's Society of Alberta and Northwest Territories. Here's why I'm letting you know about this. You have until tomorrow, Friday the 20th at 5 p.m. Mountain Time to make a donation. I appreciate that. I mean, you can donate all the way through. But if you donate a minimum $100 by March 20th, 5 p.m., that's Friday at 5 p.m., you'll qualify to win 2 club seats to the Edmonton Oilers Tampa Bay Lightning game coming up this Saturday, the 21st of March. You can make a donation, $100 or more, and immediately qualify for those 2 club seats. Thanks to everybody who has already. Really appreciate it. And of course, any donation is appreciated. A lot of you are doing this in honor of someone you've loved, maybe someone you've lost to Alzheimer's or another form of dementia. We love you guys, and we're proud to participate in this as a member of Team Cali Crush. It was amazing to hang out with our friends from Kubi Energy last night at the comic strip. That was UCAN Youth Services Comedy Night, and a sold-out room, a packed house. Absolutely fantastic stuff, and I want to let all the Real Talkers that were there know how much we appreciate you coming up, saying hi. Some of you taking me up on my offer to buy you a beer. I appreciate that. Love meeting you out in the wild. The team at Solar by Kubi has done an amazing job, of course, not just establishing themselves as Western Canada's busiest solar installer, but also big community contributors. And I want to give a big shout out to them for their support of UCAN Youth Services. You can get a free solar quote today, by the way, if you check out Kubi.ca. That's Kuby.ca. If you're looking to spend more time with loved ones, family, and friends this Easter, as opposed to being in the kitchen while everybody else is enjoying themselves. You've been in that situation before. I've been in that situation before. Our friends at Catering by Friesen would love to take all the work off your plate with their signature Easter meal. You can check out cateringbyfriesen.com. Let Friesen Brothers handle Easter dinner while you enjoy the holidays. Their chef-prepared signature Easter meal will feed up to 6 people, including everything you need for a delicious feast. Roasted turkey, scalloped potatoes, creamy dill carrots, granny stuffing, Caesar salad, tray buns, cranberry sauce, turkey gravy, apple crumble pie. You get it. 6 people fed for just $239 plus GST. You can order up until April 9th. There's other options as well, including dinner for 4 for $99. Get the details at cateringbyfriesen.com. You've been there, pal.
I'm on the website right now. I'm signing up.
You're signing up.
You can't get pre-orders. I got to show up.
And as well, they've got the vegan box. They've got all kinds
they got
of stuff.
Everything.
Friesen Brothers has really zoomed out their offerings over the years, really broadened their offerings. Again, cateringbyfriesen.com. And we shouldn't mention UCAN Youth Services in the comedy night without giving them a big shout out. If you're not following UCAN Youth Services on Instagram yet, go ahead and do so. They've got some wonderfully inspiring videos that remind us why we do what we do in support of this organization that's empowering young adults, helping them find a path out of harm's way and onto economic independence. Again, you can find them on Instagram at UCAN Youth Services. And you can check out their website as well. That's ucan.ca. A big shout out last night at the event to the employers in the room. They found that, if you're a company that's looking for reliable, motivated, entry-level employees, UCAN is an incredible pipeline for that. And it's really neat to see the partnerships there, John. We had Real Talkers working in industry last night that were that there was some healthy bidding underway for the Lunch with Me and the Real Talk Studio tour, which was awesome.
All I want is more real talkers to get into industries that I love so we can get deals.
There you go. There you go. Hey, as we return to, obviously this is difficult subject matter to discuss, and I want real talkers to know how much we appreciate what you're sharing with us. I'll also let you know in about 10 minutes we're going to be welcoming 3 representatives of Edmonton's best restaurants as identified by our friends at Edify. We're going to wrap this episode up having some fun talking about the restaurant industry, talking about food and drink and everything that we love in hospitality and the culinary arts. But this is real life, talking about MAiD. I don't know if you have a take on this or an opinion on this.
Of course. I think I told you my grandmother passed away a few years ago from complications with COPD, and she chose MAiD near the end. And it definitely isn't what everyone's making it out to be. Like, you go in, you ask, and then it just happens. She obviously was having trouble breathing for over a year, and then came into the hospital. She asked about MAiD before she was even admitted to a room. Social worker came out and talked with her, before she even went in. Then she was admitted to a room. They talked to her a second time. She talked with my mom and different people in our family. And then a third interview where they said, okay, here are some options for palliative care. Like they don't just say, this is the one road. They offered her palliative care, other ways of dealing with pain and keeping comfortable for the rest of her life. And if she wanted it, and they said, think for another day. The following day, she said, I'm going to choose MAiD. Then they gave her 3 different options for that. She chose the one she was most comfortable with, and 8 days later, she passed away. So in that respect, I didn't want to see my grandma suffering anymore. She didn't want to be here anymore. She had lived a full life. She was 90 years old. She'd said goodbye to everyone she wanted to, and she was dragging around a canister to breathe, for the last year of her life. And she'd fallen down the stairs a bunch of times. She just had a lot of things that were just building up, and I could see it. The last time I went and visited her in Ontario, I was just like, this is no way to live, right? So in those instances, I think MAiD is 100%, an effective and way to give someone an exit that is comfortable, right? I do agree that like, I don't know if it should be narrow, as Erica said, but they should be reviewed, right? It's not just obviously old people at the end of their lives who are suffering, who are applying for MAiD. So,
well, and I appreciate you sharing that. One of the things that's really tough to read or to hear is where someone says that, the poverty that they're experiencing is leading them to consider
I hear that
MAiD,
a lot, actually.
or a lack of social supports is making it, making them feel as though MAiD may be their only option. I think that is, and I'm not trying to make my, I'm like, it's tough to hear. It's obviously tough for the person that's experiencing it, but I think that's one that as a society, we need to grapple with and take action on. Tracy
hard.
says, go ahead.
No, I was just going to say it's hard though. If like, who am I to tell someone who's living on the streets, possibly addicted to drugs or whatever, but is going through pain, is starving, all these different things, to tell them that, like, hey, you have to continue living this. I understand. I'm not saying that should be a viable option for people who are just experiencing houselessness and poverty, but it makes me so sad to think that there's people like that who are like, I don't want to starve anymore. I don't want to sleep in an alleyway anymore. I don't want to be, cast out by society anymore. And that's the only option they think they have.
Yeah. Tracy says MAiD in Alberta is extremely hard to get. Your doctor refers you to a team that is often stretched. It can take months to get the first assessment than months of paperwork. Crystal says, I do agree it's probably easier to get MAiD than to get social supports, but will limiting MAiD force the government to make it easier to access those supports? That from Crystal. Like, is they're getting set to claw back the federal disability benefit? And, we'll link, I'll tell you what we'll do in the show notes is we'll link to our episode on AISH and ADAP because I think it's an important one for people, for our live stream audience. We'll get that punched into the live stream shortly. Plain Power says if there are no support measures to help with recovering from a major setback, then it is not freedom of choice. D-Grade says, I spent time experiencing MAiD with a family member. It turned out to be such a peaceful, beautiful experience and way more grounding and meaningful than I expected. That from D-Grade.
Well, you can imagine, like especially with my grandma, like we kind of knew, we all got to call her. We all got to say, we kind of knew she was exiting. But imagine the stress it puts on a family when someone's in palliative care for months or years and just, you know what I mean? You don't know when they're going to go. You're sleeping at the hospital. The whole family is stressed. So in those instances, I can see where it brings a lot of comfort. A lot of people also bringing up different stories they've heard about, I know there was a story about the vets being offered MAiD and stuff like that. I'll just say that outside of stories, in quotation marks, doctors are, obviously we know, legally required to make sure patients understand they have other options with palliative care and stuff. They don't just, you don't just ask for MAiD and they come out and give you your MAiD options. They always legally have to tell you there are other ways to deal with your pain and whatever you're going through.
Yeah, I'm as we speak, for those of you that are watching the show on the live stream presented by California Closets, I'm punching the link into the chat for that episode that we had on AISH and ADAP. That was the last time that Trish was with us, as a matter of fact, and I know that their advocacy. It's kind of an interesting is not the right word, but it's a tough scenario because you understand where Trish is coming from and the families that she's advocating for in these situations where you say you don't want people that have mental health challenges or people that require social supports being counseled to MAiD as an alternative to social supports. I get that. Mm-hmm. And I also understand where like Tracy D is coming from in our live chat powered by Park Power. She says, why is anyone on board with the government being more involved in your healthcare decisions? Says these are the same folks who whined and cried about wearing masks in a global pandemic. That from Tracy D. I mean, I get it. I think, I don't want to open too many cans of worms at the same time, but, this legislation also includes, Johnny, more support for Catholic health facilities that have been, as it stands right now, refusing to facilitate MAiD assessments. They faced legal challenges for this. They won't even host the assessments, let alone carry out the services.
Really?
Patients, we've heard stories of patients that have had to transfer out of, for example, Covenant Health facilities in the Metro Edmonton region to another facility to request MAiD. They've been meeting their assessors in bus stops and on sidewalks.
Oh, geez.
Outside Catholic hospitals. There's a real lack of dignity. Mm-hmm. This is public funding going to the Catholic system. I personally have a real problem with it. Before Catholics and other people of faith pile on me, I fully support your right as a medical professional to refuse to provide MAiD, to refuse to provide other women's health services like abortions. That is your right as a health provider. But if the health facility is being funded by the public and members of the public are being admitted to those facilities, then those members of the public, in my opinion, deserve access to all legal health services. Sure. And I think that we should have a bigger conversation about that. What I think is wild about this is that the bill, Bill 18, would also create an exclusion zone of 150 meters around any healthcare facility that refuses to allow MAiD consultations on the premises. So we're looking out more for the Catholic health facility, these individuals that are essentially being asked to leave their dignity on the counter while they step outside in their hospital gown and meet with a MAiD assessor in the bus shelter. Now we're forcing them to be 151 meters away from the hospital. You know who else we do this to? People that try to bomb abortion clinics. Like, we're putting them in the same boat. That's the other exclusion zone. Remember that one? I remember Sarah Hoffman talking about it when the NDP was in power, and they were sick of people protesting outside women's health clinics, outside abortion clinics. I'm not sure about that. I mean, this to me is like, all government is ideology. I understand there's a faith influence on the United Conservative Party. I get that. I get that the Catholic lobby is very strong, but I would be remiss to ignore that element of the legislation. And you can let me know what you think. If you agree with me or disagree with me, to talk@ryanjesperson.com. I see the name Haas in my inbox. Haas has been sharing passionate and thoughtful takes on talk shows I have hosted for at least the last 10 years. And I haven't heard Haas's name in a while. So to see them at talk@ryanjesperson.com means a lot. Haas says, 40 plus years I've been struggling with mental health challenges. First prescribed medication after my first marriage failed in the early 90s. The helpfulness was so short-lived. I'm not sure if maybe they helped or I just lied about them helping out of obligation to my doctor. Failed attempts to find meds that worked went on for about 10 years. Ended up at Unit 62 at the Royal Alex. A month later, I was declared well enough to go home, and with my bottle of pills, that's what I did. I went home. The shrink wanted me to take a year off, but as a single guy with few financial resources, not working was not an option. Things went okay, but eventually the meds stopped working again. I did find at this point, and everyone, I'm just reading, this is someone's personal experience. This isn't medical advice. Haas says, I did find that cannabis helped quell the ambition to act on the feelings of hopelessness. So I used that to manage. Eventually, however, pressure from medical experts convinced me to quit weed. 3 years later, I ended up in the psych ward again. Another month in full-time care got me back to manageable status, sort of. But by this point, it was clear that my only relief was by way of cannabis, limited to quelling the ambition to act upon the desire to start the car in the garage. This is powerful stuff Haas is sharing. Says, so I started smoking weed again. Since then, I haven't engaged with a mental health professional. I'm here, I'm alive, but I'm surviving at best. Life provides little to no joy. Haas says, I'm tired. I'm tired of struggling. I'm tired of inadequate solutions. I'm tired of life. Rarely a day goes by I don't consider what I already outlined. So when news broke that the feds were going to allow mental health patients to seek relief through MAiD, I got excited because finally I saw a real solution to my challenges. No more need to suffer if I so choose. He has that in all caps. Says, I can't tell you the relief just knowing that provided. Now, I'm not suggesting, he says, that I'd immediately request MAiD when it became available, but knowing that the option was there when I became too exhausted to continue was freeing, and I was actually grateful. He says, describes the government, says, now the uncompassionate clown party wants to codify my suffering in law, and I'm disgusted by it. I guess the premier figures she'd prefer my daughter to find me in my car than let me reach the end of life in a dignified manner with family there supporting and understanding my decision. Haas says we treat dogs better than humans when it comes to end of life. This move is gross. I've tried to get better, but it ain't working, and like I said, I'm tired. That from Haas. Sending you love today, Haas. Thank you for taking the time to send that email.
And these are the stories that I hear that are just, it's heartbreaking. I don't know. Like, it comes to a point where sometimes you think, why shouldn't they have the option? Why shouldn't they have the option? People are depressed. People are going through pain. They're not necessarily the people that I was just talking about, like, my grandma, the elderly, but they're people who just, their quality of life, for whatever reason, it's not always just, an ailment health-wise. Sometimes it's mentally, sometimes it's other stuff. But then there's all these question marks, Ryan, because, if you're battling a mental health issue, are you competent enough to make a huge decision like that? So everyone has to be reviewed. I think everyone should be reviewed thoroughly, but it's just, I do believe it's a right, though. I think MAiD should be, a right. It should be, it's your body, just like anything else.
Yeah, and again, we'll hear from a bunch of people. I know we will, and I know we'll get emails on this, and we encourage you to. We can do more on this. We can talk about this in more fulsome fashion, because I know that people will make compelling points that we've not even yet considered. Raging Granny says, so if someone has a disease with years of physical suffering ahead, but no foreseeable death over the next year, the choice is taken away from them. Right? Game Time Y says, why are people allowed to dictate someone else's ability to live or die with dignity? Noob says MAiD is an option someone should have available to them, but who gets it, when, and for what is something that should be up for discussion and review. It is a growing and changing option. Christy says, we're talking about the same province that's literally cutting funding for disabilities as we speak. Ambustion wonders, why are they inventing problems? Says, I get this is like theoretically an issue, but they just keep finding things that could happen and spending time and money legislating that instead of real issues. Matthew says some people don't want to deal with pain and suffering that they know will never go away. Nia says a person should be able to decide their own fate. The GOA needs to stay out of this legislation. It's a slippery slope in the province. They're not trustworthy when it comes to protecting rights. Plain Power says the government has cut or dismantled community supports, so suffering is all that's left. Who wants to suffer and create harm to family members? Les putting 5 into the super chat. Thank you, Les. Les, I want to say something personally to you. We would read your comments on this without you kicking into the super chat, because Les is someone that has shared personal perspective on this in our live chat for a long time.
Because of poverty.
If I have to think of one audience member that's talked about MAiD more than anybody else publicly, it's Les. He says, 3 years ago, I applied for MAiD based on poverty. Also, I'm in a wheelchair. I am eligible. Says my application is still open. Lightning Rod says, who has the right to tell me how to live or die? Crystal says, if anybody fighting against MAiD fought instead for better supports, maybe we'd get somewhere. Bucky says this is intolerance, dressed up as concern for the rights of vulnerable minorities. Bucky, I would 100% agree with you if not for people like Trish. Do you know what I mean? Mm-hmm. Like, I guarantee you Trish is here in earnest from Inclusion Alberta, and I've known Trish for a long time, and her advocacy and her team's advocacy is remarkable. We may not, Trish and I, see eye to eye on this, but also we're coming at this from totally different directions, and I'm not going to pretend to know more about advocating for people with disabilities than Trish. Do you know what I'm saying? By the way, we'll have a follow-up on this tomorrow, and we invite you to check that out, our next episode coming up on Friday. My Name Goes Here says we cannot have both. What the hell? You know, track to MAiD is an option that people seek because of problems in the broader system. So now you want to drag them through life unwillingly because it makes you feel bad? Ms. KD, with a very important point, says physical disabilities, mental health are such a huge spectrum, which is totally true. Mm-hmm. I'm going to read this one from Megan. Megan wrote into talk@ryanjesperson.com, says, my husband chose MAiD last year. Megan, we're sorry for your loss. She says, I won't share personal details, but everybody needs to understand this. He was suffering and he was not going to die soon. Took him a long time to decide he wanted to end his life. His life, she says, all caps, not your life. She says, remember, he left me behind. We were married for almost 20 years. Do you think that was easy? Says people don't live in my husband's shoes. People don't get to decide for him what was appropriate at the end of his life. People don't get to take away his dignity. The government's taking away from people like my husband the idea that they're a person, that they get to choose how they live or die. She wonders, Premier Smith, who are you talking to in this province that says people should be kept alive just because we can? This is Megan's perspective. How do you expect my husband to cope? What's the point? Someone who can no longer be independent, no longer sleep, suffering 24/7 with zero relief. Who exactly should take care of him and with what resources? Why should he stay alive? Because other people said so? Are they visiting him? Are they washing the sheets after his accidents? Are they feeding him, preparing his meals, paying for his medications that do little to nothing to alleviate his pain? Are they living his days of not being mobile, not being able to communicate, losing his eyesight, losing his hearing? They were not there. Megan says, my husband always said he wouldn't wish his disease on his worst enemy. Do people think about that? Do people think about the families that are doing their best emotionally, physically, and financially to support someone suffering and maybe the suffering's just too much that it's okay to let go? Megan says, words cannot convey my disdain for this recent announcement, MAiD restrictions. How dare this government? How dare you insinuate my husband did not have a good death, that my husband did not make the excruciatingly difficult decision to end his life on his terms? You're saying his suffering was illegitimate. He should have just put up with it because the government says so. Megan signs off by saying, I have no way to truly convey the crushing sadness and the feelings of dismissal that this announcement has imposed on my heart. Whew. Megan, thank you. To talk@ryanjesperson.com. You know, this is powerful stuff. And I guess the takeaway at this point, Johnny, is, you know, in my opinion, this does need to be a personal decision. And at the end of the day, when people talk about freedom, and you hear a lot about freedom from this government and supporters of this party, and I believe that many people approach this specific conversation with the right heart, and I think considering others, and others don't. But at the end of the day, if you're a freedom supporter, then you have to believe in the personal rights of the individual, autonomy when it comes to health decisions, and rolling back rights in this case. When Trish argues it on behalf of people with disabilities that are being allegedly counseled to consider MAiD when it may not have otherwise heard from them, or occurred to them rather, that's one thing. But to limit conversations with health professionals, to not allow conversations in Catholic health facilities, to impose that reasonable death over the next year requirement.
Yeah, it's my feeling is like I know it's a complicated issue where you have to assess every file, every person individually. But if you're going to argue like the UCP is and restrict people's access to this, you better be pumping up every other aspect of life that helps people to not make this decision. And when you've got a mental health institution, whatever policy that's described as decent out of all the provinces, when your healthcare system is middle tier, when, you know, access to ramps, people who are disabled in Edmonton, we're at the bottom of the list for ramps and just simple ways of getting around, people who can't walk and things like that. And To get in to see a doctor, to talk about your pain, to get help, to get pain relief we all know what that's like. We all know what it's like to even get in to see a family doc.
Yeah.
That stuff all better be top of the line. That better be top shelf if you're going to be arguing against MAiD.
Mm-hmm. And then there's others like, of course, the California Closets live stream here is across 7 different social media platforms. You can watch us on LinkedIn. You can watch us on TikTok, Instagram, wherever. On Facebook right now, Daniel's watching us, and he leaves the comment. Keep up the great work, Daniel Smith and the UCP. Albertans are lucky to have strong conservative leadership and the best premier in Canada. For Alberta to keep prospering, Albertans need to keep the province NDP free. Good job. Daniel's not necessarily considering anything related to any of the factors discussed. I don't know Daniel personally, but for some people, support for this legislation will have absolutely nothing to do with MAiD. There will be no consideration of families or personal health rights or autonomy or right to life or right to death or whatever. It'll just be blind partisan support and keeping the province NDP free, like Daniel. So there will inherently just be some support for this no matter what. I want to know where you land on this. You can send us an email anytime to talk@ryanjesperson.com, and we will, of course, follow up on this in episodes to come. If there's a point on this that you think maybe we're missing, a point that wasn't yet made, you didn't hear it on the show, we encourage you to make it so we can broaden our conversation. We can make it more meaningful and better representative of where this audience is at and where Albertans and Canadians are at on this. We appreciate it. We appreciate those of you that are, I'm sure, in many cases, stirring up some pretty difficult memories. I bet for some of you, you are honoring the memory of somebody you love and sharing their story as well to further this conversation. In just a second, we're going to turn the page and we're going to get into this. This is Edify's annual ranking of Edmonton's best restaurants, the champions who are running the city's absolute best. And we've got 3 Real Talk debuts coming right up. We talk about our live chat. That doesn't happen without Park Power. They're powering that every single day. Your friendly local utilities provider with electricity, natural gas, and internet. I love how Park Power operates. They guarantee the service that you receive when you bring your business to them is going to be just as good as whoever was providing service before, if not better. And the only difference, you're just going to pay a little bit less. More money in your pocket, quality utility service, and no cancellation fees. You can learn more at parkpower.ca. If it sounds good, keeping $150 in your pocket right around the time that first bill rolls around, check out parkpower.ca/realtalk for exclusive promo codes. If you bundle internet, electricity, and natural gas at parkpower.ca, the promo code REALTALK, all one word, will knock $50 off the first bill for each service. $150 in savings at parkpower.ca/realtalk. Hey, if you love playing poker and if you love supporting a great cause, you're not going to want to miss the Ben Stelter Tournament. I love this. The Hearts and Hands Poker Tournament getting set to go down April 16th and 17th at Pure Casino Yellowhead. I'm going to be there all in on the first hand. Just kidding, guys. Just kidding. But I will be there at the table April 16th. I'd love to have you next to me. $50,000 up in cash and prizes. Custom champion rings for the final table. That's all cool, but the bigger picture is that all the money we raise is going to help bring the Ben Stelter Center for Proton Therapy and Neuroscience to Edmonton. You're going to learn more about that later this month with a custom special edition Real Talk Roundtable. You can register for the Hearts and Hands Poker Tournament today by visiting benstelterfoundation.com. And we want to remind you of the service available with our friends at North Road Investment Council, that steady hand and studied voice to guide you through wealth and investing. I loved Kerry Williams' interview on the show. It was the 24th of February. If you want to go back into our archives, talked about how AI is disrupting markets, in particular just piling on tech stocks. What does that mean for your portfolio? Well, hear Kerry out by checking out that episode. And if you liked how he operates, if you liked his perspective, or if you've heard his colleague Marshall McAllister on the show before as well, we highly recommend you sit down with them for a conversation on navigation around wealth accumulation, investment advisory services. You can connect with North Road Investment Council today by visiting northroadic.com. Well, this is a super cool opportunity and kind of an annual tradition here on the show. We're so proud to partner with our friends at Edify Edmonton, and they have just done an unbelievable job yet again with their annual Best Restaurants issue. And we're excited to welcome 3 of the individuals whose teams are featured in this Best Restaurant issue to the show. Daniel is here from Nero and Bianco. Gabi is here from Pip and Next Act, and Jack is here from Juu Ku. It is wonderful to see the 3 of you. Thank you for making time for us. I'll get you nice and close to the mic so we can hear you. Gabi, Best Brunch, Pip, Next Act, institutions in Old Strathcona, just off White Avenue for people that aren't familiar. You have a smile on your face that says to me, we appreciate the honor, and we already know that we're the best brunch.
Yeah, I mean, it's always an honor, and I think what it really means is that people are just continually choosing to come back to us and trust us and know that every time they visit, they're going to get a great experience. And the fact that we can continually deliver on that, that's really where the honor is.
Yeah. Well, I'll profess my love for what you guys do in just a minute. I'm going to talk about my favorite dishes at the restaurants and all that kind of stuff. But Daniel, congratulations, recognized as, I know Best New, which is pretty exciting stuff for Nero. Downtown diners will know Bianco as an institution along Rice Howard Way. Just an incredible spot. By the way, it's where Stephen Mandel and I often go for our little hangouts.
Totally. I think I've seen you there
he's fallen in love with Bianco. But Nero has been this new project that you and the team have been working on getting open in the brewery district, and the location itself. It's like, for people outside Edmonton that may not know, talk to us about the building it's in.
Yeah, it's pretty crazy. I mean, it's over 100 years old. It's formerly kind of Molson Brewery. I think it's the Alberta Brewing and Grain Company before that too. But we're really fortunate to be able to be in a historic building in Edmonton too, for both Bianco's kind of like just position in the city, and obviously Nero now too. It's we're really lucky to be in kind of those historic prominent places, we just want to treat those spaces with respect and kind of do them justice. So
yeah. Well, you're doing it, and it's beautiful, and I love the decor, and we'll talk about it in a bit and the bigger impact of all this. Jack, it's great to have you here. Thanks for making time for us. Everybody's talking about your spot.
Oh, fantastic.
Everybody's
Thank you.
Talking about
it's an honor.
Your approach to the menu and everything else. A real standout, I think, on Edify's 2026 list. Can you talk to us about do you call it a Pan-Asian concept?
Pan-Asian concept. So we try to include quite a few different countries. Hong Kong is kind of our home base as a chef. Grew up in Hong Kong, and myself as well. We love the Japanese cuisine, and we dabble into the Korean cuisine and the Vietnamese cuisine. So let's just include everybody in there. And in many ways, we would talk about how we cook what the chef love to eat, to share with the people that comes into a restaurant. And that's the excitement for being in Juu Ku, and just getting all of that all in one place. And you can come in many times to create your own menus and tasting, and you can still get something different.
What's the impact of landing on a best restaurants list like this, Gabi? I mean, it's not the first time that the restaurants in your ownership group, and we should point out, like, for people that maybe haven't been familiar with seeing like MAiD and Pip and Next Act and all these places, it's like it's one ownership group, but it's basically a standalone restaurant district. Like, it's actually super cool on both sides of the street, which is really neat. Do you find that recognition like this from an institution like Edify, people see it in edifyedmonton.com, do you see the numbers go up? Do you see more enthusiasm around it, more curiosity around it? Does it impact consumer behavior?
Yeah, absolutely. I think for those that already know about us, it's a reminder to come back. But there are a lot of people too that I think when we're on that corner, we've built that community, sometimes we forget, people actually still don't know about us on that corner. And so it brings in a lot of new guests that we haven't seen before. People that haven't been in a few years, or often too people that don't know that we're all under the same family. I mean, our 3 owners, they're childhood friends, and they've built up that corner over the years. And so it's nice that each restaurant maintains its identity, but then also we have this really great community among them. And so it's nice for people to maybe they've tried one. This is a chance they've get eyes on us to come try another. But it always gives us a boost, and yeah, it's always great to be featured.
Yeah, no kidding. Well, and it's well deserved. Daniel, one of the things that struck me when Nero was getting set to open, and guys, I don't want to sound like a bummer, and I'll get all your take on this, but coming out of COVID, and you know exactly where I'm going with this, and the economy's down, and we're people are saying there's like the at work crowd, there's not as many people working out of the office, and so the downtown lunch spots were kind of suffering, and not as many people downtown. Maybe at night, maybe there's some safety concerns. We've talked on the show a lot about that, and then here you guys are, as we're seeing restaurants close, and it feels like a gut punch every single time, and you guys open this audacious, this like ambitious, audacious, beautiful, I'm sure very expensive restaurant. I've been in there a few times, probably not cheap to build. What gives you the confidence to everybody that lays down the cash and makes that happen and opens the doors at a time where it's not always the case?
Totally. I think it's like just with Bianco's success, obviously, like the support that the city has really shown us, and making that possible, kind of giving us confidence to be able to branch out and just feel like the city's ready for more good Italian food. But yeah, with the building too, it's amazing. I'm not sure if everybody knows for the brewery district there, but there's like hundreds of free underground parking spaces right below us too. So especially downtown for business lunches or anything like that, trying to, even park this morning here. It's
pain in the ass, buddy.
Exactly.
It's a pain in the ass is what it is.
Putting it nicely, right? So having that, it's been really great, just to kind of take the stress out of your visit, especially with construction and stuff like that. You can kind of just find a spot there, come up for a nice meal. And then, just kind of looking at that Western block, like there's a lot of great restaurants, just kind of down, 120th Street, 124th Street. That's kind of becoming what I feel is kind of like that new corridor for, a lot of, just like good restaurants in the city too. So
I'll let everybody know we're going to link to the pages for all of your restaurants so people can book their reservations right away as soon as they hear these interviews. But I'm curious, Jack, like when you go to open Juu Ku, what do you use as sort of a strategy out of the gates? Obviously being named to like a best restaurant list is huge. You got to have like a strong Instagram presence, right? Strong social presence. Word of mouth is huge. Most new restaurants probably don't have $65,000 to deploy on a big sort of faceted marketing campaign. What's key to launching strong and really making an impact?
Getting the right people doing the right job, to be honest. I think Chef Fung was definitely the head lead on all of that connection, motivating all the staff to bring in the best game, bring in the A team, and just bringing those food out in front as much as we can and try to make as big of a splash, as much talk as we could. Yeah.
Your website's beautiful, by the way. Yes. Did you have anything to do with that?
I do not. They keep me in the kitchen for a reason.
Do you get the impression, Gabi, like is Edmonton a food city? I was born and raised in Calgary, moved up to Edmonton, late 20s, early 30s. The second half of my life has been up here. I'm in one of those weird positions where I love both cities. And so people often ask me about the other. Like, how would you compare Calgary to Edmonton, this, that, and the other? And everybody always says Edmonton's cultural scene, the art scene, the culinary scene. Do you get the sense that Edmonton is a food city?
Yes, like through and through. I think especially with our winters, I mean, Calgary too, but what are we going to do except for go out and eat? And I think over the last 10 to 15 years, we've really seen the diversity of the offering grow. And I think for sure it is. We get visitors that come in even from Vancouver or Montreal and are really surprised by our food scene and how much we have to offer and the diversity of what we have to offer. I think 100% we are.
What's your favorite dish at Pip?
At Pip? It's a hard choice. I love them all. But if I was going brunch, I'd say the classic eggs Benny, the dill hollandaise, just like elevates a classic dish just a little bit. And at dinner, the whipped ricotta with focaccia. It's all made in-house. Connor and his team in the kitchen. The focaccia they make from scratch in-house, and it's got a truffle honey on it. And then the focaccia is made in-house too. So we really pride ourselves on homemade ingredients that just bring classic dishes to a little bit of a new level. So that would be my go-to.
Your burgers get all the love at Next Act,
Yeah.
I would say. The peanut butter PB&J burger,
Oh, yeah.
you call it a peanut
Yeah,
butter burger?
so crazy,
But you know what I
but
think is most
so good.
underrated there is your mushroom soup.
The
Phenomenal.
Hungarian mushroom soup. Yeah,
Right?
so good.
It's no joke. I'll try
Yeah.
mushroom soup on any menu.
Yeah.
Yeah. What do you think is the start? This is going to be a tough one for you, Jack. The Juu Ku menu is like, what country are you even going to start in right now? What's your favorite item on the menu?
Start at home. The beef hor fun, a dry aged beef picanha hor fun, where the history come from cooking for the labor in Hong Kong, and they just put small amount of beef instead of what we're doing. We're putting a whole picanha steak on top, but frying the noodles is actually a test of our chef ability, and starting from there, and then sushi menu, because that's where I work. So anything on there would be absolutely amazing.
I heard a comedian that was here in Edmonton, and one of their opening bit was on seeing sushi restaurants in Edmonton, and they were taking, you know where I'm going with this? They were taking big swipes at Edmonton, and they were wondering who on earth would eat raw fish in a landlocked prairie province. Why would you ever have sushi in Edmonton? What would you tell that doubter? What would you tell that individual?
Until you try. But I would agree with him. I asked the same question. I was training in Japanese restaurants. Like, why do they exist? Because people still love them. So that's why we're here.
But logistically, the challenge of bringing in fresh fish, do you do it multiple days through the week, or how do you do that?
Multiple days, and of course the technology of food have grown so well that certain fish actually come frozen and they still come fresh. Let's be honest. They freeze them on the sea.
Yeah.
Right after
They're
catch
frozen
them.
on the boat, right? Like
Yes.
flash frozen, yeah.
Flash frozen on boat, and they come in, and if you defrost them properly and you actually treat your ingredients with respect, the food will come out just like how you would expect it. And honestly, we still get food from all around the world, ingredients from all around the world to get us to where we need to be. So
We're getting a lot of comments here in the live chat. People are sharing their favorite menu items at your restaurants. We do have a vote.
Thank you.
I will say someone throwing back to the mushroom soup. Do you have Filipino food at Juu Ku? People are asking if you have Filipino food there.
we're working on a few things. We have definitely a plethora of staff that are really excited about putting some stuff up. We have to talk about that.
But you're in a really neat position because you're not like, if you say, if you market yourself, maybe this is more of an old school way of thinking, but if you're like, we are a Japanese restaurant, then if you roll out a Filipino dish, I don't know if it'll throw people. I don't know if it really matters. But you're not that. Or if you're like, we are a Chinese restaurant, or we are a Thai restaurant, but that's not it, right? That's the model. Was part of that the idea around that of attracting a broader customer base?
Part of that is, yes, attracting a wider customer base. At the same time, we want to, like I said, we have all background. A lot of the cooks have a Western cooking background, but we have our heritage where we want to bring to a forefront, and cooking in different style, different ways, make us unique in the sense that you probably won't try this anywhere else. And yes, a lot of confused customers come in and say, I thought this is all Japanese, and they see us standing in a bar expecting a wide Japanese menu, but we got a lot of hot food that are really, really good.
Yeah. Daniel, when you're putting a menu together, first of all, I got to ask, what's your absolute favorite menu item at Nero?
It's got to be the spaghetti and meatballs. Can't beat a classic. So,
Old school.
Yeah, definitely.
I love that. What's the key to it, or what's the secret for people that are listening right now and they go, my Nana's, nobody can beat her spaghetti and meatballs?
Oh yeah, I know. It's it's a tough dish to kind of get really good, but we make all of our pasta fresh in house, so that's a pretty good starting block for things. So we actually have kind of our own proprietary blend of flour that we use across the locations as well too.
Really?
So that's a little bit of the secret sauce, but just kind of starts with good ingredients, just doing things in house, as much as we can as well too. And then just good technique for executing that stuff too. So I mean, from 6 years old to now, spaghetti meatballs is always kind of going to be one of the favorites, right? So
I should let most people hear this on the podcast. You were smiling the entire time you were answering the question. Does food make you happy?
Yeah, it's it's one of the things that gives life a little extra zest, right? So yeah.
Was this designed to be like a sort of I think of like a yin and yang type scenario with Bianco and Nero, where Bianco is very light. The design is like light and bright and airy and white, and then Nero is like dark and brooding and reds and blacks.
Yeah,
right?
definitely. It's we want to do something a little bit different. Like Roman cuisine is kind of the main inspiration for Nero. So even for the pizzas, we're doing kind of a focaccia style crust on there. So a little bit denser, but still just as tasty. But just trying to like not oversaturate or kind of take away from the existing spots as well too. So
that's got to be a challenge, Gabi, when you're looking at like as soon as we mention a menu item and your eyes light up and then the audience lights up and people start talking about it. It's like you can't get rid of the favorites. But does the typical customer, maybe aside from the regulars, I mean, I see people posted up at Next Act, they're there every single day, and you love the regulars.
Oh yeah.
But does the typical consumer look for changes and new approaches and something different, or do we like comfort and consistency?
I think it's a combination. I think there's such a comfort in a dish that that you can return to time and time again, and it's going to be the same and it's going to be reliable. But I think it's finding the balance between always making sure that we're challenging ourselves and leveling up and making things better where we can, while also still offering that comfort and making sure that people know, you love us for these reasons and that's never going away, but we also never want to get too comfortable. So always challenging ourselves to do something different and something more exciting. It's a delicate balance.
I'm looking at this corn Alfredo tagliatelle with crispy pancetta,
it's delicious,
charred corn, Parmesan chives. People in the chat are not appreciating this. They're saying that we're making them hungry. That well, you know what to do.
Yeah.
You know where to go.
Yeah.
You know where to find these people, these brilliant creators. We should shout out, by the way, Trudy and Kim and the entire team at Edify that do an amazing job with this every year. If you check out edifyedmonton.com, you can see and read through their Best Restaurants 2026 feature. You can read this, obviously, from anywhere in the world. I have no doubt that some people will make the choice to come visit Edmonton just to tick these restaurants off their list. We'll also point out that Edify hosts their annual an absolutely wonderful Best Restaurants event. That's coming up on Monday, the 23rd of March at the Convention Center, Hall D. They're not joking around. They get like the biggest room in the city, Hall D at the Convention Center. VIP access at 5:45, doors at 6:30. And this is your chance. You can pick up a VIP table. Bring your friends, bring your colleagues, bring your family. Sip, sample, and savor. Taste some of Edmonton's cuisine from these restaurants that are featured in Edify's Best. All three of you will be there on Monday. You guys are all going to be represented. Are you able, is it a secret, or can you tell us what you'll be preparing, what you'll be offering that night? You look, Chef, like you look like you're not so sure, Jack, whether or not you want to disclose. We're always looking for exclusives on Real Talk. This is the thing.
Chef know the secret, so he didn't disclose.
He did
not disclose all the secret with me yet.
I feel like you're playing. You got your cards close to your chest on that one. That's fair. That's understandable. Can you tell us, Daniel, what Nero will be serving up?
Yeah, we're doing I know for sure we're doing a fresh pasta, and then you kind of have to, right, to represent. But there's going to be a golden beet salad as well too. So
golden beet salad,
definitely.
Hey, I'm not trying to get you involved in a fight. In a quarrel.
I'm ready, yeah.
Are most Italian restaurants making fresh pasta, or most Italian restaurants like dry pasta out of a box?
I think it's a combination. I think it's getting a little bit better. The bar across the city is being raised in terms of food quality everywhere. But I'd say like we're probably one of the, on the frontier a little bit, just from Bianco's opening as well too. That's kind of been, I think, something that's allowed us to be successful, and people can taste the difference, right?
Yeah.
So
would you like to take this opportunity to name any restaurants that are using dry pasta out of box?
Maybe in Calgary, but I'm not going to.
I love it. Gabi, what are you guys serving up at the Best Restaurants event on Monday?
Next Act's got mini critic burgers, which is our most popular burger. And then Pip has their whipped ricotta and focaccia, like I was mentioning before.
I love that. Emily G, by the way, says Next Act had the best nachos when she was in university in the early 2000s. Are they still on the menu?
Confirmed. I just had them on Tuesday.
What's
They are
so great
the
about
best.
them?
I don't know. The chip stays so crispy. Like, it doesn't stale out, and there's lots of cheese, and the cheese is layered, which is what you want.
Ken K says they've got a Rezzo and Nero in April. Says he loves the food at Bianco already. Says you guys have an epic espresso machine.
Oh yeah.
What's so special about the espresso machine?
I mean, it's kind of the Ferrari in the espresso machine world. It makes our lives very easy for the bar team to pull great espresso. It's automatic kind of calibration for volume and things like that too. It's fancier. It's definitely more expensive than my car.
I'm going to ask you how much it cost.
Yeah.
How much does it cost?
I think it's gone up. So it's somewhere around 20 grand
Really?
plus, which makes me a little nervous every time I use it, but it does work well. So
That must be a pleasure, though, to use it. Can you tell? Like, can you honestly? Like, we have an espresso machine at home that's pretty nice. It was a gift. I'm not going to pretend like I bought it.
Yeah.
But it's like a few grand. Like, it's really a spectacular machine.
Yeah.
Could you tell the difference from a $3,000 machine pouring an Americano or an espresso to a $20,000 machine pouring an espresso?
It comes down to the beans a lot of the time as well too. I'd say that's the big difference, but I'll say yes, but it's kind of crazy what the entry level price for a machine is these days. Like,
People have no idea what it costs to open a restaurant. I remember talking to friends in the industry. They're all going to text me after this, by the way, and wonder why they were not on the round table on the panel. And I'm going to tell them because you're not in Edify's
Gotta
list.
be on the list.
You got to be on the list.
Be on the
I'm
list.
sorry, my career is a dormant. You're not on the list. Was never a dormant. But they talked to me about, like, if something goes wrong with the HVAC, or they got to swap out like a whatever freezer, or this, that, and the other, and it absolutely blows my mind. There's got to be a willingness you got to be really sort of able to stare risk in the face to open up a restaurant, don't you? I mean, you got to, I guess, have faith in your target audience, your customers, that they're going to show up and it's going to be all worthwhile. But it's no joke, this business. What's the biggest splurge at Juu Ku?
I would say the team.
Oh,
Honestly,
you're paying your team too much?
I don't know, but no, I would believe that any equipment aside, if you don't have the right people to actually service and make the food right, it wouldn't matter. The equipment is not going to cook the food by itself. I have a really knowledgeable team, and my sushi bar is absolutely amazing, and the knowledge back there is it's older than some of the kids that are working in the back kitchen as well. So when I look at that, I think that's the biggest flex.
Yeah. I love that. I love how you answered that question. Someone here right now, by the way, is going, proprietary flour? What? What? Yeah. Is that true?
It
is. Like,
yeah.
you would, like, no matter how much we pressure you here.
Yeah.
If we say we're not going anywhere,
until
you tell us what it is, you would not.
I won't crack. Yeah.
You won't crack under cross-examination.
No, it's just it's an organic flour that kind of just gets milled specifically for our restaurants. So it's proprietary is a fancy word for it, but it's just something that we have that's kind of unique to our spot.
I love that, though.
Yeah.
And I'll give a little shout out to another business. He's not on the list, but he could be. But my buddy Ryan Huska, he owns Dog Island Brewing out of Slave Lake, and they do this Saints and Sinners IPA. If you guys are looking to put an IPA in I know you guys have Saints and Sinners. I know you sell a lot of Saints and Sinners. He told me that. But anyway, he was telling me the other day, he says and this is exactly why he won't share information with me, because he knows within 72 hours I'll be in front of a microphone spewing everything he's just told me. But he says there's 6 different hops in Saints and Sinners. And he was telling me, and he's going through, and I don't remember what they're called, but he's like, there's like the citrus one and this, that, and the other. And then he goes, and then number 6, he goes, is an absolute secret. And I was like, oh man, don't be annoying. Like, just tell me what it is. And he was like, oh, absolutely not. And I was like, who am I going to tell? And he's like, I'm not even telling my wife. He was like, this is a protected secret. He'll name the 5, but he won't name the 6. Yeah. Like that one hop, whatever it is that they use, is like key to nailing down the specific flavor profile of that beer. And I thought that was so neat. So cool. I want to congratulate all three of you for this and your teams. I've known some of the people in your restaurants just as a customer, someone that's been proud to come in, and it's unbelievable how each of your teams at Next Act and PIP, at Nero, at Bianco, at Juu Ku have just gone above and beyond and earned these well-deserved honors. It's so much fun every year for us to partner with our friends at Edify and continue to shine a light and amplify this message that there is amazing work happening in the culinary arts here in the capital city. As we wrap, I want to ask each of you something that maybe you're expecting, maybe you're not, but a big part of what makes Edify tick, is, even if you read it on their main cover, city, business, culture, life, Edmonton. They're big in the community. They're big in understanding what a healthy community looks like, healthy industries. They're storytellers. Outside of the food, what do you see? What role do you see your restaurants playing as contributors to or as institutions within a city? Outside of the food, how do you see it?
Yeah, I think we have a responsibility to keep adding and building the community in our city, however that is, because restaurants aren't just a place that people come for food. It's a place that they come to celebrate their lives. And when we look at Next Act, for example, they're a huge player in the arts community, especially where we're located. The Fringe is a really important time of year for us, and even just supporting smaller arts. We highlight an artist on our walls. It rotates every 2 months. It's a local artist. We put their art up, give them the opportunity to get eyes on them and to sell their art in our space. And it just makes sense because at the heart of what we do is about people and it's about connection. So finding opportunities for us to help build our community outside of just serving food, it just completely aligns with what we actually do.
Absolutely love that. How would you answer the same question?
Outside of the jobs that we contribute to the city, I would believe that it proved to people that a dream can happen. Because Juu Ku is a dream of Chef Fung, and in a way, I was pulled into that dream and be allowed to be a part of that and grow, being able to actually build a physical restaurant around this dream and serving the food that you love with other people. It's just amazing. And I think that should inspire many other chefs, and that's why chefs become chefs. They want to serve people, they want people to enjoy their food, and just seeing that look on their face when they take the first bite, it's like, wow.
Yeah.
That's what we want to see. And being a part of that is hopefully we can inspire the next generation, give more chef more opportunity in training, and allow them to bring the bar even higher.
I love that. And I'm so glad you mentioned Chef Fung. He's been, Andrew Funger's been basically like an institution in Edmonton for years. I remember eating the stuff that the stuff. I remember but his creations like way back in the day at Black Hawk Golf Club.
Absolutely.
And then whenever there was like rumors and they were like, he's opening 19 and everyone got really excited about that, and 19 in St. Albert, and he's built that people will drive across the region to eat his food. And I remember when there were rumblings of Juu Ku opening, a lot of people were like, just based on his name and his reputation as well, we're like, they'll do the same thing. They'll drive across the city to eat there. Give him our love and respect, will you?
Absolutely.
Yeah,
Absolutely.
It's so good. Yeah. And finally, my man, last word to you on the community front, on the city building front, the role of the restaurants.
Yeah, I mean, I'd say for Bianco and Nero, like, we're open 7 days a week. We're in it, every day. But really, we get a lot of joy out of creating, a space where people can have memorable experiences, whether that's celebrating birthdays, grad season now too, like even working yesterday, just seeing those groups come in, choosing to celebrate with us, having that community, like chance to get people together in the same room over a meal. We feel very fortunate to be able to have a space that welcomes people, now in 2 locations as well too. So just, seeing smiles on faces, seeing people come in for the first time, be kind of wowed by, the chandeliers at Nero, the candles at both places.
Yeah.
But Seeing people come in from even, rural Alberta, slightly out of town, into Edmonton for the first time. It's cool to be able to host that amount of people in a space that, we want to, curate for that. So
I'm going to close with a weird comment, okay? I'm sorry. I'm 48 years old. I'm starting to reconcile the fact that my hips and knees are not what they once were. I'm getting a little gray in my beard. And I had a conversation with a buddy, he wouldn't want to be named, a restaurateur in Edmonton, a successful one, within the last week. And I told him that I was welcoming the three of you. I told him that we were going to be celebrating best restaurants. And he was sharing his thoughts. And he said, the one thing that concerns me most. I said, what? He said that we're not going to have the builders in Alberta like we've had in past. He's my age as well. He's 48. He's done really well. And he's I'm trying to decide right now if I should name him. I don't think I should. Should I name him, guys? Should I name him? Do you guys know Nate Box from Black Box Hospitality? Like Fox Burger and like old back in the day, like Elm Cafe, and he's working on some new. Anyway, you're not going to find a guy that cares more about restaurants and food and his city than Nate. And he was telling me, he said, I just folded like a cheap suit, by the way. Look at that. Why you got to reveal the proprietary flour if I just gave Nate's name on the show? But he said to me, I'm concerned that there's not like the next generation of risk takers. He said, I don't necessarily know that I'm going to see young people that are going to be willing to put it all out there to go find the financing, to take the risks with no guarantee it's going to work. And he goes, and I worry about the fabric of the city, the health, the culture of a city if young people aren't there to continue what we've been working so hard to build over the past number of years. And I just want to say, and here's where the comment gets weird, as a 48-year-old, I guarantee all of you around the table are quite a bit younger than me. And I just think it's fantastic. I think it's fantastic that your teams have nominated you to be the ones to do these interviews. I think it's fantastic, the leadership that you're showing in your spaces, the innovation, the passion you have, the command, the knowledge you have of what you're talking about. And I feel like, and I will convey this back to Nate the next time we play virtual golf, I will let him know that I feel like Edmonton's culinary scene is in good hands. And I'm grateful to have you all here.
Appreciate it.
Yeah, and if I can just add on that too, I think it is such a scary industry to be in because there is so much risk. But if you have, it's also one of those industries that's one of the last ones left that you can rise up in, and you can start from I started as a host and I moved up into management and now into more of an office position. And if you have leaders that believe in you and invest in you, like those will be the people that continue on the industry and take the risks, and as long as you have that support.
I love that. So well said. Thanks for being here, Gabi. That's Gabi from PIP and Next Act. We'd hang out with Jack from Juu Ku, and we'll give a shout out to 19 as well. Why on earth wouldn't we? Yes. And Daniel in from Nero and Bianco. To the three of you and to your teams, congratulations on being named to Edify's Best Restaurants for 2026. Real Talkers, you can read the full list. Check out, the photography. Edify just raises the bar every single year. The write-ups are beautiful. EdifyEdmonton.com. That's also where you can get your tickets. You'll see it right there to Edify's Best Restaurants event, the annual event. It goes Monday, the 23rd of March at the Edmonton Convention Center. I hope to see you there, and a big shout out to the team at Edify for everything that they've done. JJ Needs a Nap, by the way, in our live chat says, well done to all these folks. These three, starting a restaurant is tough work. Keeping it going, keeping people coming through the doors is a lot of work, says JJ, and especially after COVID, even more so. So well done. From JJ Needs a Nap in our live chat. Real Talkers, as we wrap, we'd love to hear about your best restaurant. You can send us a note what you think about this to talk@ryanjesperson.com. And of course, the heavy lifting that we did earlier in this episode, many of you will walk and think about it. And if you choose to send us a note, we'd be honored to consider it to be read on the show. Tomorrow, we're back at it. More disability legislation, as a matter of fact. We'll take a look at that. And Pierre Poilievre on Joe Rogan. Pierre! What the hell? We're still waiting for your email back. We'll talk to you soon.
Real Talk is hosted by Ryan Jesperson, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, Voiceover by me, Carrie Skelton. Member Emerita, Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjesperson.com.